I'm curious about why human societies and communities, don't better optimize their use of science and scientific methods. And I'm also curious about how it is that institutions can better serve communities and build bridges of trust that are going to be necessary for us moving forward. So my name is Brian Southwell. I am a distinguished fellow at RTI International. RTI International is an independent nonprofit research institute, which is based in North Carolina.
Tell us more about what you do overall.
I have the good fortune of, at this stage of my career, being able to work on a combination of new projects to figure out how it is that people engage with scientific information and scientific institutions, as well as an opportunity to put a spotlight on other organizations and researchers who are doing work try to build community at this time of polarization and discord. In my own work, increasingly, I've been working on a number of collaborative efforts to highlight the importance of engaging with communities. And there are a number of examples of that. Some of that work has to do with refining our messaging strategies and our communication, approaches for talking about new and emerging research. We recently highlighted some of that in a paper in the Journal of Public Health Management and Practice, for example, in which we were looking at the optimal ways for an agency or an organization to talk about emerging information with regards to foodborne illness, outbreaks. And in that case, we found that acknowledging scientific uncertainty, offering transparency, offering people a way to understand and see how their values and interests might be aligned with the institution that was announcing, seemed to go a long way. Actually did improve perceptions of trustworthiness. We did this in a large scale, national experiment. I'm also involved in work that highlights the value of working with communities themselves to develop communication strategies. I'm actually heading out to the Society of Behavioral Medicine annual conference. We were finding ways to recruit people to clinical trials, and I was doing some work with the Fred Hutch Cancer Center out in Washington. And one of the things that we found was that we actually engaged in a large scale effort to work with a set of community sites across the country, and then compared those to some control sites. And we found that in instances where we developed social media strategies that really highlighted local landmarks and local cultural institutions, and that really suggested tie-ins with local community, those places saw a greater boost in registration for community for clinical trials than the control community. So it's a good example of working with community partners to highlight the local ties and ways in which that might matter too. Lots of examples like that, but I think in practice, this is work that should be done. Can be resource intensive sometimes, but nonetheless, it's really important.
Can you give me some examples of like how related to clinical trials organizations can connect better with their communities?
Often there are networks and local sites, and instead of thinking about national efforts per se with generic messaging, it's possible to actually work with local community organizations, to think about what aspects of participation in trials, for example, might be relevant or important to people in those communities. And by co-creating some of those messages and outreach, that seems to be advantageous. We actually found that once we launched this localized campaign, that relative to a big national push in the localized areas, we saw this big jump in registrations. So it's really can be just a matter of spending time to think about who outside of your team might be partners in local communities that you might be able to work with. Yeah.
Are there certain types of clinical trials that don't have a lot of, I guess, appeal or way to communicate on a national basis and that they need to connect with their communities more?
Yeah. So in this particular case, I was working with a group that is developing an infrastructure for trials to develop HIV vaccines, and that's a stigmatized area of disease, and there are a lot of reasons why sometimes there might be concern or hesitation there. But that's a good example of an area that we need more scientific research. We need everybody to potentially be available to participate in the development of those types of vaccines, and that's been something that we've been able to work on, like I said, with the Fred Hutch Cancer Center and University of Washington colleagues.
It seems like there are many aspects of your research that also overlap with that particular study that you're doing, and so much more information. For example, like a recent paper that you did related to AI. Can you talk more about that paper?
We had an opportunity, in the fall, to pull together, collaborators from all across the country on a meeting that we held here in North Carolina, along with partners at Elon University, and it was also here based in North Carolina. And in that instance, we were able to pull people together to think about emerging opportunities using artificial intelligences in different ways. But we also were really interested in what roles humans are going to have in the organizational implementation of and use of those AI tools. And one of the things we realize is that there are a lot of different activities and endeavors, but we need a more collective forum to generate good research questions. And so we brought together about 200 people, from everything from AI developers to university researchers to folks, working in a variety of different organizations. And we had people ask, what would be relevant questions for us to be answering with regards to the use of AI in creative endeavors, in healthcare, and in other sectors. And we had a chance to kind of work through and had a day-long session where people came together, tried to refine, research questions. And then we actually used, a variety of different, AI-assisted, approaches to try to make sense of all that qualitative data. And so it was this real partnership between teams and groups. So we had folks working in a variety of different ways, and we pulled all that together in an RTI Press white paper that we recently released, in which this offers both some ideas about how it is that people might work with AI technologies, but also what some of the pertinent questions are that we need to answer. And I think there's lots of opportunity for follow-up, there. But what it really offers is a research agenda for people to look at. And so that's something that we're hopeful is going to spark lots of additional conversations. And rather than people just kind of off doing their own thing, really trying to work together to compare best practices and to compare notes. That's something that we think is going to be important. So we think we've established something of a learning network. We had hundreds of people online, but then also a few hundred people in the room, and hopefully there's going to be an opportunity for folks to continue to work together. Here in North Carolina, we had representatives from 7 area universities, who in many cases are people that are thinking about the development of initiatives and the AI related agenda at their own universities. And so the chance to convene and to bring people together, there is a theme there, and that's something I'm quite interested in doing, and that I think RTI has been good at as a independent research institute, to try to help people compare notes. Yeah.
So you had a major contribution to the National Academy's report about understanding and addressing misinformation about science in
Yeah.
2025. How is that related maybe to this new era of AI?
I've long been interested in how information flows through society, and that I think it's important for us not to assume that that always happens in a totally functional way. There are possibilities for dysfunction, and there's things that ways that those patterns that we might sometimes recognize that we might want to address, and that they aren't always serving us well. And I think that the availability of inaccurate information in our current information environment is something that's a lot worries a lot of people. It's potentially distracting, and misleading, and potentially even harmful to people as they're trying to keep themselves healthy, keep their families healthy, to try to move through and make good decisions about new technologies and emerging science. But that's a problem that's been with us for a long time. It's not necessarily new, and I think something that you often see is that a buzzword sometimes will emerge, and there's a fair amount of research that happens. People are busy, trying to get grants or to do work under this heading without necessarily a lot of thought as to exactly what it is that we're talking about. And I guess one hallmark of my career has been being willing to sort of look at pretty basic terms and to ask questions about, well, what is it we actually mean by that? And I think by taking that step back, we can sometimes take a step forward in terms of coming up with ways to address that. Misinformation is a good example of that. It's an area that, the word has some meaning to a lot of people. You hear it in lots of headlines, but actually thinking about what it means as a problem for society it requires that we define it in particular ways. And I think we really need to see it as an instance where people are not necessarily, they're making claims or they're listening to claims that are at odds with the bulk of scientific evidence. There are lots of claims that get made sometimes that you or I might not agree with, but that aren't necessarily at odds with the bulk of scientific evidence because we don't have that evidence yet. And so we've got to have some humility here to recognize there are some instances where things are obviously clearly at odds with what's been generated, over time by scientific communities, and other instances it's speculation or and we've got to respect people's opinions and theorizing. And so I think partly, I guess, the approach that I've taken and with the consensus study, I think there was some resonance of this. So we have to see the problem of misinformation at a systems level as a situation where you've got generation of scientific evidence from a social perspective. Not that's not always making its way into all kinds of discourse and debate, and what might explain that gap? What might explain some of the challenges that we're seeing as people are attending to information that's not grounded in scientific evidence? And for me, that leads to the general theme of trust in institutions, because I think in a lot of ways, if people if we had a situation where people trusted in what was coming out of scientific institutions, we would have fewer of these problems. Even if there was a lot of distracting noise with regards to misinformation, you could worry less about that. But so really part of the problem, part of the challenge is this situation where people aren't necessarily always certain who to trust, or we've got worry and concern about trust in institutions. So that requires that we actually spend some time thinking about another basic word and term, this notion of trust, which is actually one that is another common sense term, but yet if you think about it, we don't spend a lot of time actually defining and really unpacking that. And I think we spent too much time thinking that trust is a function of intellectual credibility, that it's a matter of, well, this person has letters after their name, or that may be that is likely a part of it, of the consideration for a lot of people. But there's also a dimension here that really matters to a lot of people, and that's this sense of shared value or shared interests. This idea that you and I are talking, and if I'm giving you health advice, it probably matters if you think if I care if you live or die. If I have other motives and you don't think that we actually share values or interests, there's probably a difference between what I might be saying and our relationship in terms of trust. And so I think the same thing happens at an institutional level, sometimes. And so that takes us, there's really a through line of connection to, if we're going to worry and think about being perceived as trustworthy, we probably need to offer more transparency, need to offer, a sense of what motivations are, what values, institutions share, and what the goals are for what it is we're trying to do. I think that's a pathway through a lot of this. I think that notion of trying to collectively figure out what our goals are, what our values are, and then working together to reach those. Whether you're talking about the implementation of AI, or you're talking about a health message, or you're talking about an effort to try to mitigate misinformation, that's not a bad starting place. And so it really, for me, I think we don't spend enough time working together as communities to kind of first set the table as to like what is it we're trying to do, and what are our values, what is it that we're trying to accomplish, and then moving forward with messaging strategies and information sharing and all that. But we sometimes skip over that kind of level setting, and that's so I guess there is that, as we're talking about it, there are some points of connection with all this. the National Academies of Sciences, Engineering, and Medicine has long been, a really great institution to convene and to reach points of consensus, also bring together disparate viewpoints. The consensus study that we worked on with regards to misinformation is a great example of that. Spent a few years with experts, trying to come to terms with what we mean by misinformation, what do we know in terms of literature, what can be done about it. More recently, I've also been working with under the auspices of national academies. Generally, there's also the National Academy of Medicine, and I've been working on an action collaborative, there that's been a really interesting effort to try to maintain, build, rebuild trust, in medicine. And the approach that they've taken is to think about what could be done at a community level to respect the lived experiences of communities, to engage with communities, to build that into the way that National Academy of Medicine does their work. We recently had an opportunity to convene up there, and it was great to hear within the National Academy of Medicine an emphasis on humility and engagement, and those are I think going to be really important steps forward for all of us.
What made you want to dedicate your profession to studying communication?
Honestly, I think there are lots of stories that I found inspiring over time that have or haven't necessarily received much spotlight. I So for me, I think the possibilities of what can be done together in community when we put a spotlight on certain stories has always been compelling. But I've also, I don't know, I see a lot of the pain and struggle that we face as failures in communication. I know that, uh, and I personally, I think that's partly what probably drew, me to, thinking about, systems, thinking about, obviously there are interactions between any two people that, they can go better or worse. There are great opportunities for that. There's so much potential, for people to connect, with each other, but the only possibility we have as individuals or as communities of kind of extending beyond, our own private space, and any hope we might have for sort of greater connection is really dependent on, communication and kind of figuring out ways to have what's in my head potentially match or marry, or sort of think about, some connection with what's in your head. And it's amazing that we can do that. But it doesn't always go, particularly well. And so I've often been, really inspired to think about aspects of society that we sometimes take for granted. We've grown up in a world where, now so much is available on our phone, and it's been the case in our lifetimes that you can turn on a television or have some, but all those things, news outlets and newspapers and other, all got built, by people that decided there's something here that needs to happen with regular reporting, with ways to kind of connect dots. And so, to me, the fact that we've been able to develop those organizations, those tools, those mechanisms over time, means that we could do something, new in the future too. That we some of the trouble that ails us, right now, that maybe we could address if we, put a better communication infrastructure or we better exercised, some of that. I'm not foolish enough to think that that's going to solve all the world's problems, but I do think that there's a lot that's attributable to communication failures, and so that's why I've been interested in it. But it comes from a place of some frustration or worry or concern that maybe I always haven't been perfect or ideal in that regard. That I've seen a lot of communication breakdown or miscommunication, and that's something that always struck me as tragic. And so I've dedicated I think part of my career to trying to overcome some of that.
Yes, I mean, I can think of a number of issues lately that it seems like the means of communication were very much a factor in terms of the success or the failures of certain things that are affecting so many people right now.
I think all the way back, to my days as a undergraduate, looking and there were lots of things I got, interested in and involved in, but I remember, at one point there are different concepts and constructs in both philosophy and rhetoric and others. And there's this notion of stasis, this idea that in order for two people to really make progress in a debate or anywhere else, you've got to agree what it is you're talking about. You have to have some point of connection. And so often people are kind of ships passing the night talking past each other, and you don't have they're using words, but they don't mean them the same way. They're not You should have that point of engagement. Doesn't mean you're going to totally agree, but you have to have some point of engagement. And around the same time, I got really interested in. I had a chance as an undergraduate to, study with Julian Bond, who was a civil rights leader, a really important civil rights leader, in the United States, and this course on the history of the civil rights movement. And one of the things that struck me was, there's so much in that successes and failures and challenges that partly were a function of communication dynamics, in different ways. And of course, there were fundamental, clashes and really important, dimensions there. But there were opportunities and hope that seemed to happen sometimes when, the TV cameras, went on and people saw people in a new light, or they saw some of the travesties that were happening, or there were different ways of talking about, some of the problems that have been with us for a long time, but that allowed us to make some progress moving forward. So. Yeah, so I don't know. All that probably drives some of my interest. It's uh, and and there are a lot of good and practical ways, also to get involved with the translation of all the really remarkable work that some of my colleagues, often do, and so that's something I like to try to help out with. Yeah.
How would you maybe think about ideas or tips for taking that into practice for PIOs who are communicating science on a daily basis?
Let's think about a somewhat a mechanism that's been with us, for a while as an organization, like a press release, right? And so you think about, well, here's a chance we're going to put something together, and put it out into the world. And there's a lot of worry and concern sometimes about, how that's crafted or what gets, put in the headline. And that's a skill, and that's part of, what you want to do. There's a couple of dimensions of that that I think are really important. One is, to what extent have you paid any attention to what's already out in the information environment, to what the audiences might be seeing, or how this might fit into a larger conversation. One of the pieces of advice that I often give colleagues that are just starting out in academic publishing is for them to think less about, putting the headline version of like their great research out into the world, but instead to think about how they're entering into the ongoing conversation that should be happening in academic literature. If you think about journals as a place of conversation and not just as a place of individual people, shouting, "Here's what I have to," and it doesn't always. That's a romantic vision of it. I don't think it always happens, but I do think the extent to which you can view yourself as stepping into an ongoing dialogue, I think that's really important. So a PIO, similarly, ought to be thinking about how what they say might resonate or not, with what else is out there. There's also a really important sort of opportunity that I think sometimes communication practitioners have, to both externally think about how what you're saying might resonate or fit, but also to what extent have you really engaged in an ongoing conversation with, for example, the researchers that you're translating their work? Have you checked back with them to see, does this really, cover what you think it does? And just recognizing there's room for iteration and for ideas to emerge. And sometimes, it also can be the case that you framing a particular study in a particular way might cause the researcher to start to think differently about it. And that can be disconcerting, but it might also be healthy. But there needs to be feedback loops, often in what we do. And I think that we sometimes don't do that, sufficiently.
We see it newswise so often. Sometimes there can be just a paper that's published that can be distributed as a research alert. That's what we call them. And if a PIO is translating that into something more for a general audience, it is much more likely to be viewed and picked up by the media. And so it's so helpful, that translation of that. What do you think about that in terms of the need, like, to be able to access more people, to reach more people, and the importance of that role?
There's a difference between seeing the need for translation as opposed to, looking down at people. Just because somebody doesn't have the lived experience or the background doesn't mean they're not able to understand what you're talking about. It just means they've been busy doing other things. They might be trying to, pay their rent or take care of a sick kid or working, in some other profession. And so just giving people, some grace and realizing that translation is a respectful step. It's not a matter of, watering down your work, but it's just a matter of transforming it into a different form that can live on and can extend the life of it potentially. That to me is really healthy. Generally speaking, one other piece of advice that I'd offer is that I think we sometimes assume that humility and and leadership don't necessarily go together, and I think that's false. I think that there are ways to show humility and the idea that you don't necessarily know everything there is to know in the world, but that doesn't mean you're not, bringing, you can't operate with some degree of, of credibility and leadership, still. But I think this notion of, figuring out what it is that other people want and need as being part of your job as a communicator and as an organizational leader, I think, it's just something I've always taken to heart. And I think that it's, I, for better or worse, I think that sometimes the most problematic people and organizations are the folks that are overly focused on confidence in their own sort of viewpoint and assertion of that, and as opposed to recognizing that there's room to think about what you're bringing to the table, and how that might fit with what other perspectives might bring too. So.
Right, and it goes back to what you were saying before. Sometimes it might be non-shared values, which might be needed to be addressed.
All this emphasis on discernment of shared interests and values, I don't want to suggest that there won't sometimes be conflicts. There will, and that's. But I think at least have a clearer basis for understanding the basis for that, and that could be a good starting spot, as well. So, but yeah, we do live in a pluralistic society in a complicated, world in a lot of ways, and it's not going to be always possible for everybody to see everything exactly, the same way. But I think there's some steps we can take to try to mitigate some of that anyway.
Brian, thank you so much.
My pleasure. Thank you so much for all that you do.
Curious by Nature is a production of Newswise. More than 7,000 journalists get the Newswise wires. Visit newswise.com and find out how to spread your news today.